Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. The samskara is to take away the bad thing in us and inculcate the good habits. So, according to that, we have Dr. Sunanda Kulkarni, our Professor Arish Kulkarni's daughter, who is a professor to professors. She has trained hundreds of obstetricians and gynecologists, and then she continues to work after retirement as a professor, head of the Department of Obstetrics Gynecology from Bangalore Medical College. Welcome, Dr. Sunanda. We are very, very happy to have you as with the most experienced obstetrician in Karnataka, and that too a gold medalist in gynecology. And today, the time has changed. It is not like the olden days where they used to pray and worship to God and then lead a pious life in order to get a good child. But today, the youngsters have gone astray. So, before they become pregnant or deliver, what are the things to be looked for and what are the advices you would like to give them? Please go ahead.
So nowadays they get married late, and then
Yes,
reproductive lifespan is very less. So
yes,
they should come when they plan to become pregnant. They should come and consult the doctor. So
mm,
because we may not know what is happening in our body unless we do other tests. So
right.
they may be having hypothyroid, or they may be having some heart disease. The you see with heart disease sometimes
Yes,
it may be detected, or only after marriage if they become pregnant, when they go to doctor, then they are like diabetes. They may not
yeah,
have diabetes. First time it may be discovered like that. So
yes,
unless we do investigation, we cannot make out what is the problem. So they
mm,
should, before when they plan, they should come and consult the doctor, and
mm,
the list of investigations when they do, then if
mm,
there is anything, they will correct
mm,
it. So they can get corrected. For example, obesity. Nowadays,
mm.
obesity is considered as a disease. So the
Yes,
obesity can be corrected, hypothyroid can be corrected, and if they are taking some tablets for epilepsy, which
mm,
they might not have told husband and their family, so she can change it, and then she should take folic acid, which is helpful because it is some neurological disorder. This one, for example, anencephaly, meningocele,
yeah.
meningomyelocele, all those.
And
Okay,
spina bifida, all those
bifida.
things, all those things can occur with the deficiency of folic acid. And apart from that, even congenital heart diseases can occur. And that's why if they start the folic acid, both neurological as well as the cardiac heart problems can be reduced. In fact, it is a preventive one. So, excellent point you have mentioned. Please go ahead.
And see, those who take these drugs, epileptic drugs, they will have more deficiency of this
Yes.
folic acid. So that's why they should take more, not your regular quantity, more quantity. So if they
Okay.
come early, we can tell them. But
Mm.
and then not only that, you said samskara. I
Mm.
recollected 2 points in this. There
Mm.
are Shodasha samskara. In
Oh.
that, Garbhadana, and next
Ah.
is Pumasam, next
Mm.
is Srimantam, next is
Okay.
like that it is Shodasha Samskara. So usually whenever the patient comes to me, I always tell, no, don't hide it. Tell your friends, tell your relatives that you are pregnant. And
Mm.
and then when you said she is pregnant, they will invite you. And then
Yes.
whatever is deficient in your diet at your
Yeah.
home, which you are not preparing something dishes,
Mm.
they may be
Yeah.
preparing. So baby
Yes.
will get varieties. It is not the
Yes.
quantity, different varieties she will eat. So Srimanta, in Srimanta also, Hangiranada
Yeah.
Kubusa. So that
Mm.
is sunrise and sunset. Banada
Yes.
Kubusa, that is in the garden. And then
Yes.
Amasai Kubusa. Night.
Yeah.
Uh,
Night.
and then the Beldingala Kubusa. So
Yeah.
like that in
Moonlight.
different moonlight. So that
That
time
they
they prepare
enjoy.
everything white.
Yeah.
Curd rice and this papad like that, and
Mm.
kheer. So something all white. Hwangirana something like this juice
Golden.
or carrot like that.
Yeah.
Then carrot halwa. So something that color resembling that
Yeah.
color they
Okay.
prepare. So what is the meaning is she should
Mm.
eat everything. That is a
Okay.
one sanskara.
Okay.
And then next, one more thing what I
But
wanted to tell.
Nadine, everything means not the junk food, not the drugs, not the smoking, not the alcohol. This is
This one,
absolutely, absolutely the ancient type of good food. So
good
please
food.
tell us about the bad habits now.
I will tell. And one more thing I want to tell. in our epics, we have come across with Prahlad and Abhimanyu.
Yeah.
Both they were listening when they were in utero.
Yes.
So
Yes.
baby also listens what is going on
Yeah.
outside.
No,
So their
scientifically it
mom.
has been proved.
Hmm.
Scientifically proved
It is
that
true.
they
So
can
they
hear
should.
well. Yeah.
So they should. That's why our ancestors used to tell, listen. They just see
Good
Ramayana,
music.
Mahabharata, read it like that. They should have, and then music. So calm mind they should have. That is the 2 points. Old one, which is not old, is gold.
Yes.
Old
Yes.
is
Yes.
not dustbin. Next, I
Okay.
want to tell now our modern girls when they go, not in the city, they may, for example, Bangalore girl may work in Delhi, and she may work in Calcutta, or she may go abroad. And
Yes.
the environment there is change, is different. So with the friends, they learn some habits like drinking, smoking, taking drugs and all that.
Drugs.
Sometimes they may be alone. So they in that period, they may become the prey for all this. So when they become pregnant, once they develop habit, even if you remove H, it a bit remains. Even if you remove
Remove
A,
A,
it
bit
remains.
remains.
Even if
If
you
you
remove B,
remove
it
B,
remains.
it remains.
So better
Huttu
not
guna
to have
sutru
habit.
hogalla. Okay.
Uh, uh. So that's why what they should do, they should not become the addict of that.
Yes.
That's why it becomes difficult for them to leave it. Now they say only occasionally, once in a month I drink. No, even if you take a smoke one per day, one smoke, the cigarette per day also is bad. And not
Yes.
only that, if your partner is smoking, that also reduces the fetal
Yeah.
weight by 400
Yeah.
grams.
This is absolutely right because the Baltimore study has shown that a woman smoking, her baby will be premature, the weight will be less, and then the right sided heart disease will be there and it will be very severe. And then, if the husband is smoking, he's taking only 15%, 85% comes to the wife, and
Yeah,
that also is more dangerous. It is more
yeah,
dangerous than smoking yourself,
yeah.
and
Yeah.
that's the reason both husband and wife must be careful.
Both should be careful. So actually, husband is protected, wife is
Yeah.
not protected there.
Correct,
So
correct.
and because finer particles he leaves, big particles he smokes.
Yeah.
So that's why both husband and wife, they should not smoke. And then he, at least she should not drink,
Yes,
and then she should not take any drugs. These
yes.
recreation drugs like marijuana, heroin, amphetamine, all these drugs she should not take
Cocaine,
because they have got all of them have got effect on the baby. You are
baby.
telling FG, this one premature baby and heart disease. Not only that, premature and FGR together. The
Yes,
baby may have prematurity as well as FGR. And these
yes.
babies, when they grow up, they are prone for many diseases. So
Diseases
my
because their immunity level is low. And apart from that, if I mean, the parents are taking alcohol, the child will have a hole in the heart when called as a ventricular septal defect, and then it will have the fetal alcoholic syndrome, and that the face is ugly, and
different
then the
face.
head becomes ugly, and then it is born as a what to say like. The intelligence will be very low, and apart from that they become criminal, and that is the reason the parent should not take alcohol, and
Yes.
in fact it is one of the pancha mahapataka according to Rigveda. So alcohol should not be taken when they are conceiving.
Surapana Varja.
Varja,
Okay,
correct,
Varja.
correct.
So they will have baby will have box like for it, and baby also goes on crying unless you give that. If by chance if it is bought,
So
huh,
that also is addicted, baby is also
huh,
addicted to
hmm,
alcohol.
okay.
Okay.
So
This I did know.
all these smoking, drinking, and all these recreational drugs.
Drugs
Yes,
should
there
be
she has to
banned,
leave it.
banned.
It is in her hand. It is not in our hand. So no one can become police. Not husband, not even mother. Police is her mind only. Now, apart
Yes,
from this, if they come early, if she is taking some drugs, for example, for hypertension, she is taking drugs. For epilepsy, she is taking drugs. We can change it so that the baby will not be affected. Not only this, we can enlighten her many other things. For example, what type of chappal she should wear, shoes she should wear, and then what type of garment she should wear. And if she's fond of dancing, yes, you can dance. If she's fond of yoga, she can do
yes,
different yoga
yes,
during
yes.
pregnancy. Or exercise, what type of exercise? Diabetic, what type of exercise? She's not diabetic, what type of exercise? So kakutasana, so many asanas are there which are specific for pregnancy that we can tell them. And then the apart from this, the obesity also, we have to, she has to correct her
Yeah.
obesity. And then because nowadays obesity is considered also a disease. Okay,
Okay.
so if they're obese, then weight gain should not be like a normal patient. It should be
Yes,
less.
yes,
So
yes.
that we
And
tell them.
apart from that, today there is advancement in the pediatric cardiology. And there's so much of advancement, unlike in the past, we don't have to terminate the pregnancies. So, what are the things that can be detected in time and corrected? Please tell us.
Nowadays there is a scan which is a boon. So with the scan we can make out if there is a hydrocephalus. That means water is filled in the brain.
Right.
So when there is water, then the brain becomes flat.
Cannot,
There is no
yeah,
place. So if you remove the water, brain grows. So
yes,
there are operations because nowadays the girls undergraduation, post graduation, then job, then get married, then after 2 years they become pregnant. So afterwards there may not be time left for them to become pregnant again. That's
mhm,
why if they have something, nowadays there is a specialty, pediatric surgeons. So these surgeons, if there is a hydrocephalus, they do the shunt so that this water goes to the, they put the shunt. So there is a, when the water goes from the head, brain grows. That's one. And then exit procedure. In this
mhm,
exit procedure, the baby may have this cystic adenoid malformation, cystic hygroma, and then the thyroid, so many things. So baby like that, like this.
mhm.
So in that
Yeah,
case, you doctor can do cesarean section, and baby gets the blood supply, oxygen, everything from the placenta because placenta is not yet separated. So
yes,
deliver the baby only up to the neck and
okay,
do tracheostomy to the baby and then put the tube so that baby can breathe easily. Then you
mhm,
can deliver the baby. When the baby stabilizes, then you can do the surgery. So this
yes,
baby can survive. That's
yes,
next. And another one is, see, sometimes in female less, but in more more in male babies where the tip of the urethra maybe it may not be patent, so it is fused.
patent.
So
Okay,
then what happens? The urine, whatever baby is secreting,
is
it
all
goes up.
collected,
It is collected.
collected.
So it goes up to kidney. It is bladder, then ureter, then it goes to kidney. So in that case, the pediatric surgeon can make hole there so that baby passes the urine. So
Urine.
those babies need not be
Not
terminated.
only urine, even the fecal matter, even the anus can be
Yeah,
imperforate, and that
perfect.
also can be perforated.
And then the diaphragmatic hernia.
Mhm.
So so many things are there that can be repaired in utero. So they need not go for abortion.
Termination.
And that's
Okay.
one. And then one more is your subject. If they have got stenosis
Mhm.
of the in the heart, then
Yes.
percutaneous you can pass the catheter and you can
Yes,
dilate
yes.
it.
It can be done in the uterus itself before delivery. Or in one case, the mother delivered because the previous child was dead. And then it
Hmm.
was just 14 hours after the cesarean section. It didn't cry. On ventilator, I opened it with the 4 millimeter coronary catheter. And now the
Hmm.
child is absolutely normal. So these were hydrops fetalis were 100% death, but today they can be saved. Yes,
They can be safe. So they should know that such treatment exists. And then
available.
it exists. And then see, one more thing is, nowadays when the patient comes, before they come to us, they meet Google doctor first. Huh.
Google
Mm.
Guru.
Mm.
Correct.
Google doctor, they meet the Google doctor first and then they come. But
Mm.
for everything they ask, no problem, we can explain them. But see, they should come to the, whenever we say they should come and get the,
Receptive mind must be there.
they should listen why they are telling like that. And then because we say after come after 3 weeks or 4 weeks, because they know they can read in the Google what they do, nothing, baby is growing, no, why to come like that. So they should come regularly. So minimum checkup is 4, and then a regular checkup is up to 14. And nowadays, because of the ART, many may have twins. So
Yeah.
if there are twins, there is many other what type of
Many.
twins, that depends. and so they may have many other problems. So they should come frequently. We ask them to come every 15 days if they are having diabetes,
Hmm.
hypertension. In all those
Hmm.
cases, not only we see, we also,
Hmm.
they have to consult a cardiologist. They have to consult
Yes.
sometimes pediatrician before the
Yeah.
baby is born, and they have to
No,
consult the
when you said
physician.
the consult the cardiologist, I remember just yesterday, all the women in cardiology, they were discussing a 40 years old lady, artificially, she has become pregnant. She has got twins, and the twins weigh only 1,000 grams. And then she has got a heart attack, and she is almost in the shock. Now, to save the baby, to save her, it is a most difficult task. So, anyway, the technology has advanced so much. Thank you very much for giving so elaborately, so beautifully, so nicely. You have described how they have to take care of themselves. Thank you very much for your kind and good explanation. Thank you.
Thank you.